Maintaining a healthy dairy goat herd requires far more than just good nutrition and proper shelter. Many devastating goat diseases can spread silently through your herd long before visible symptoms appear. As a responsible goat owner, implementing a comprehensive testing program is your first line of defense against catastrophic health events that could decimate your herd, compromise milk safety, and destroy years of careful breeding work. This guide will walk you through the 9 most critical health tests that should form the foundation of your herd management strategy. 1. Brucellosis testing, protecting both animals and humans. Brucellosis represents one of the most serious threats to both goat herds and human health. This bacterial infection causes abortions, infertility in goats, and undulant fever in humans. Annual testing is mandatory in most states and should be performed by an accredited veterinarian using either the serum agglutination test or ELISA blood test. Beyond formal testing, all farm workers should practice strict hygiene when handling birthing materials and raw milk from untested animals. 2. Tuberculosis screening, preventing a herd-wide crisis. Bovine tuberculosis in goats caused by Mycobacterium bovis can remain dormant for years before causing visible symptoms like weight loss, respiratory distress, and mastitis. The standard testing method is the single intradermal tuberculin test, where tuberculin is injected in the tail fold and measured for swelling after 72 hours. Any positive cases trigger immediate quarantine and often require confirmatory testing and possible whole herd testing by state officials. 3. Johne's disease, combating a silent herd destroyer. Johne's disease, caused by Mycobacterium avium subspecies paratuberculosis, has an exceptionally long incubation period of 2 to 5 years. By the time clinical signs like chronic diarrhea and weight loss appear, the animal has likely been contaminating your environment for years. Testing options include fecal PCR tests for direct pathogen detection, ELISA blood tests for antibody detection, and the more definitive but less sensitive AGID test. Immediate removal of positive animals, implementation of strict calf hygiene protocols, and careful pasture rotation to reduce environmental contamination. 4. Caprine arthritis encephalitis, CAE. Managing an incurable threat. The CAE virus spreads primarily through infected colostrum, milk, and direct contact with bodily fluids. Initial herd screening should use ELISA tests on all goats over 6 months. Positive animals should either be completely separated from the negative herd. Critical control points include feeding pasteurized colostrum to kids, disinfecting equipment between animals, and avoiding shared needles or tattoo equipment. 5. Small ruminant lentivirus, SRLV. Testing SRLV testing detects multiple lentivirus strains, including CAE and Medivisna viruses. PCR testing offers the advantage of early detection by identifying viral DNA before antibody production begins. Testing frequency should be annual for CAE-negative herds, biannual for mixed status herds, and quarterly for positive herds undergoing monitoring. 6. Comprehensive Parasite Monitoring Program. A robust parasite control program begins with regular fecal egg counts using the modified McMaster technique to track strongyl, coccidia, and tapeworm loads. These should be supplemented with weekly FAMACHA eyelid color checks during parasite season to identify anemic animals needing treatment. All treatments should be applied to the entire herd simultaneously and repeated at proper intervals. 7. Advanced blood profiling for optimal health. Complete blood counts provide vital information about hydration status, anemia, and infection through parameters like PCV, 22 to 38%. Mineral testing should focus on copper, optimal 0.5 to 1.5 parts per million, selenium, 0.08 to 0.3 parts per million, and zinc, 0.8 to 1.2 parts per million levels, with breeding stock tested pre-breeding and mid-gestation. These tests help prevent subtle but costly nutritional deficiencies. 8. Reproductive health screening. Early pregnancy detection at 30 days can be achieved through PSPB blood tests with 98% accuracy, while mid-gestation ultrasounds after 45 days provide visual confirmation. This comprehensive reproductive testing ensures optimal breeding outcomes and early identification of fertility issues. 9. Milk quality assurance testing. Regular somatic cell count testing. Goal less than 500,000 cells per milliliter. Provides the first indication of mastitis problems. All milk should be tested for antibiotic residues before sale, with bulk tank samples representing the final safety check.